Hello everyone, I am here to perform an osce video for gynecology. In this video, I am going to demonstrate you how to examine your breast. First of all, let's take the patient's history like name, age and past medical history. Before starting the examination, uh, let's explain the procedure to the patient and then proceed to the examination. Before examination, let the patients undressed and give them towel to cover themselves. Now ask the patient to sit in relaxed position by placing their hands on the thigh. And now just check the masses, deformities on the breast and any symptomatic, any kind of visible mass, scars in the breast during the inspection. On second part, we ask the patient to keep the hands on the hip tightly while we are contracting pectoralis muscles. If there are any movable mass present on the pectoralis muscle movement, then it shows the signs of some malignancy. On third part, we ask the patient to keep their hands back of the head and lean forward. And then we observe the observe the breast carefully. We have to observe it very carefully if there is any kind of masses and or any deformities. After the inspection is completed, now we can start with the palpation. Make sure our hands are warm as we touch the part of the breast of the patient. We need to make sure we can palpate any asymmetrical part of the breast. Now we need to make sure to place the patient at the 45-degree incline or flat bed. Now hands should be at the back of the head while palpating the breast as well as axillary nodes. Now kindly open one side of the breast and press the nipple gently, and by observing any liquid extend from it, this shows any kind of infection present on the breast. Now using a spiral method, observe if there is any kind of masses, pain, tenderness by using 3 fingers of your one hand to compress the breast tissue against the chest wall. Feel for any masses present in the breast tissue. Kindly press down in the circular motion. Apply steady pressure presenting downwards to the chest wall, first supraclavically, then medial and deep to the levels of the breast, followed by the next breast. Make sure to palpate all the axillary nodes and then palpate the lymph nodes. First clavicle lymph node and then to the superior lymph node and above the clavicle, infraclavicle and then finally to the parasternal lymph node. After the examination is completed, ask the patient to dress themselves and explain the findings to the patient. And then allow them to ask the questions about their consciousness. Now I can conclude that conclude to the patient that they don't have any masses on the